Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today we're announcing 4 additional deaths due to COVID-19, all from the Winnipeg Health Region. I'd like to extend my condolences to the families, friends, loved ones, caregivers. The current 5-day COVID-19 test positivity rate is 5.9% provincially and 4.5% in Winnipeg. As of 9:30 a.m. today, 167 new cases of the virus have been identified. A reminder that these are cases that were to be reported yesterday and today combined. We had 96 cases today to report and 71 from yesterday, taking our total number of lab-confirmed cases to 30,932. Late last week, screening detected 7 possible variants of concerns related to the B117 variant, first identified in the United Kingdom. Over the weekend, other samples were identified through the screening process as well, and all were sent for sequencing. As of late last night, we received the sequencing of 7 of those samples, and the sequencing shows that they are not cases of the B117 variant of concern. So the screening test works to find similar mutations that are present in the variants of concern, but they're certainly not diagnostic. And so when we sequenced out, when we did the fingerprinting of this genome, we find that it's very comparable to other genomes in the community, in the province, in the country, and not the UK variant. So this is like we mentioned, that there are many variants of the virus, and that's to be expected with these RNA viruses. Most of the variants, like the one that we've detected here, do not appear to have any clinical significance. So we can confirm that at this point, the 7 sequencing samples that we have done of the flagged screen-in samples are not the UK variant. And we'll await further sequencing. This is all, again, a reminder to stick to our fundamentals as we move forward. We are trying to continue our opening plans here in light of also the threat of variants. So we have to continue to remain vigilant. So again, staying home when ill, even mildly ill, get tested, but isolate pending results. We've seen too many examples of individuals who have been out and about while ill and exposing many, many Manitobans. Cover your cough, wash your hands, wear a mask. If you are advised to self-isolate, please do so appropriately. Ensure that you don't have any other contacts when you're self-isolating. We need to continue to focus on these steps to continue to keep our numbers in the right direction. Today marks Mardi Gras, and so traditionally this is a day where Christians gather before to feast before fasting for the Lenten season. And so a reminder that our household gatherings are limited to our 2 designated individuals. Outdoor gatherings are group sizes of 5. Places of religious worship can open up to 10% of usual capacity or 50 persons, whichever is lower. And within that, we must have the physical distancing measures. And so again, we encourage Manitobans to limit the amount of contacts you have outside of your household. Practice those fundamentals at all time so we can continue to move forward. Continue to connect with those loved ones and those who are vulnerable through other means, but we want to keep our contacts down at this point. So thanks to all Manitobans, and I can open up to questions.
Thank you, Doctor. A reminder to our reporters on the line, you will have 1 preliminary and 2 follow-up questions. Up first this afternoon from CBC Manitoba, Bart. From CBC Manitoba, Bart. Okay, we'll come back to Bart from the Canadian Press. Steve.
Oh, hi, Dr. Roussin. I just wanted to double check. You mentioned 7, and we had heard that there were 7 initial tests, and these were from Cross Lake First Nation. Those are one and the same, correct?
Well, the initial tests that flagged a screen in for the variant of concern were not. They're all from the north, or many were from the north, not specifically any communities, and certainly not all from Cross Lake.
Okay. I noticed the numbers today are again very high in the north, and MKO is saying that they're seeing a lot of new cases crop up in Cross Lake and Thompson. Is that what you see? Can you tell us where we're seeing either clusters or high numbers?
Well, those listed communities are definitely where we're seeing those numbers right now, where we're seeing increased transmission. And, I think that AMC as well as MKO, they've spoke on regarding the First Nation situation. But yes, we are seeing that transmission certainly in a couple communities.
Okay, and just to double check, is it still true that the only confirmed variant of concern was the one case of the UK variant related to a traveler that was first reported a couple of weeks ago?
Correct. Yes, that's the only variant of concern to date that we have confirmed through sequencing.
From CBC Manitoba, Bart. Okay, we'll try moving on. CTV Winnipeg, Michelle.
Hi, Dr. Roussin. I'm wondering how many more samples are we waiting to hear back from the National Microbiology Lab? You said there's been 7, and you have some additional ones. How many?
Yeah, so I don't have the total amount because we don't just send ones that screen in. We send all related to travel. We send any related to, or some related to outbreaks. We send a random sample as well. So we had a number of screen-ins over the weekend, and so certainly they've all been sent, but I don't have the total number that's awaiting sequencing right now.
Okay, and so what does this mean if these 7 samples are not the B117 variant? What are we considering that it might be a new variant that's emerging here? And how do we figure out if there's any reason to be concerned about this? Does it all rely on what comes back from the further sequencing?
Yeah, so this is the challenging part of dealing with the RNA viruses, because we definitely will see further variants emerge. What's going to be important is whether they're a variant of concern. Like I said, we've done a lot of sequencing here in Manitoba dating back to March, and seen many variants. All of the ones that we've discovered aren't really variants of concern. They don't increase transmission or increase severity. So with these here, and this is why we have a large national as well as an international database that follow the variants over time. And so we will be connecting with those databases, connecting internationally, and follow these variants over time, because it's definitely possible, and we should be expecting further variants of concern develop over time.
Sorry, and my last question is for you as well here. Are there plans to use rapid tests for widespread testing? And if not, why?
Yeah, so we're working on that with some of our the rapid antigen testing and looking at ways to ramp up that in appropriate situations. So we know that we have to use the tests. Various tests have various characteristics. So we have to ensure we're using them appropriately for their characteristics. And so we're working on plans to be able to ramp up that community-based testing on a rapid, using the rapid platforms.
From CBC Manitoba, Bart.
Hi there. Can you hear me, Dr. Roussin? Hello.
Hi.
Hello. Can you hear me, Dr. Roussin?
Yes, we're hearing you.
Hello. Can you hear me, Dr. Roussin?
Yes. Yeah. I'm not. You're probably not hearing me, Bart.
Yes. Forgive the technical difficulties. What is the benefit in announcing the presence of a 501Y marker before genomic sequencing is conducted?
Yeah, there's not much of a benefit on announcing it. Certainly, public health is going to act upon it, and so whenever we see an indication, the variants of concern are so important to us that public health, we're going to act on it immediately as if it is, and then if we get sequencing that changes that, then we can adjust our measures. So, public health is planning on announcing positive variant of concern that are confirmed by sequencing, but we will immediately act on any screen-ins.
Okay. So then, to your understanding, why do First Nations announce the presence of the screening first? Is it because, what are the various reasons why they would do it differently from public health?
Yeah, well, I can't really speak for them. I think that that certainly, if they feel, if they see that as fit, then certainly I'll respect that process. I think with the issue here was that once we start getting these screen-in processes, public health is going to act immediately on them. So we're informing the people who screened in, we're informing their contacts, and so word gets out quite quick. And so to get ahead of that, to avoid any unnecessary, fear or panic, I think that's why the announcement was made.
I see. Changing the subject completely, and with the full recognition that you're not in charge of the vaccine rollout, what, if any, changes should Manitoba make on eligibility after the National Advisory Committee decided that racialized Canadians should be prioritized more?
Yeah, I think again the vaccine task force has has done a good job at one, outlining the eligibility criteria, but also being flexible. As we see higher risk groups and settings arise. And an example of that is the alternate accommodation isolation centers and ensuring that people working there have access to vaccines. So it's a flexible approach. We want to try to get to those at high risk of infection or high risk of severe outcomes or high risk of exposure, and so it's very complex. And the biggest issue really is the vaccine supply. And so they're making a lot of decisions with changing evidence. And so I'll leave it to the vaccine task force to speak on specifics. But this has been sort of our approach right from the beginning.
From City News, Mike.
Yeah, good afternoon, Dr. Roussin. A question that might be tough to answer. Do you have an inside track on if or when AstraZeneca will be approved in Canada, and how much that would help Manitoba's supply issue?
Yeah, no, actually, I don't have any details on when the approval will take place. We'll wait for Health Canada to make that announcement. Right now, our biggest issue with the vaccine rollout is quantity of doses. And so I think if we get an effective vaccine that we can use appropriately, right now with the AstraZeneca vaccine compared to the mRNA vaccines, there is a concern of decreased effectiveness compared to the mRNA vaccines. But I do feel that we'll have appropriate populations that we'll be able to offer that vaccine to, should it become approved.
And then a question here based on the press release. It says additional facility improvements are being made to VaxPort to support patient experience. Can you just kind of elaborate on what these additional facility improvements are?
No, I don't have details. I think the vaccine task force is out tomorrow, so they'll probably be able to give you some details on that.
Right. And then my last question here. I've seen a lot on social media people commenting on the NHL mask protocols and kind of taking shots at them, if you will, with coaches having to wear masks, but then they pull them off to talk to referees or they pull them off to talk to players, and people kind of just almost thinking the protocols are a joke. In your opinion, does this help the mask argument, or does seeing this on TV kind of damage a public opinion on masks efficiency?
I think overall the NHL has protocols in place that are, shown to be quite effective and, very in-depth. So, I think just overall, my messaging is to wear those masks appropriately and, at all times. It would be my suggestion. And, so I don't necessarily have anything, specifically. I haven't seen any of those specific comments that you mentioned. But, I think if we're indoor public places, have the mask on, avoid touching your mask frequently is the best approach.
From CHVN, Taylor.
Hi, good afternoon. As you kind of mentioned earlier, tomorrow is Ash Wednesday, a ceremony that traditionally has touching. We know that churches are focusing on ways to safely do this without touching. But do you have any advice for people who will be taking part?
I think it's again the where the public health restrictions are, and then right back to the fundamentals. And so the public health restrictions are, our group size limitations, only 2 designated people in a household, 5 groups of 5 outdoors, in places of worship, then that 10% max or 50 persons, whichever is lower. And then that has to be separated by households. So you have to minimize your close contact with those outside your household, washing hands frequently, wearing those masks, and absolutely staying home if you're ill, even mildly ill.
And if a place of worship has questions about public health orders in situations like this where there are specific things going on, where can they go to ask these questions?
Yeah, for anyone that's affected by the public health orders, we can go through our engagemb.ca, and we provide feedback for individuals.
And a lot of people believe that there have been very few cases of COVID in places of worship, and that there have been very few public exposures on that exposure list from the province since it's been created. Earlier, the province says that they suspect some underreporting when it comes to this. But why aren't possible exposures in places of worship on this list, and how can people know for sure what the risk is?
Well, the risk is when you gather with people in a prolonged period indoors. And so we talk about this, the virus doesn't have any regard for how important things are to people. This virus spreads indoor prolonged contact. And so we just, we don't, learn a whole bunch more about this virus. We know how it's spread. And when we see outbreaks, it's from a situation where we had prolonged indoor contact. That's where we see all these outbreaks starting. So, in the midst of our second wave in November and December, a significant proportion of our cases we weren't able to link to anything. So it was community-based transmission. So it was the minority of cases that we could actually identify where they're being transmitted. And so that's why we may not see a lot of specific examples of where things were transmitted, just because we had widespread community-based transmission. It was being spread throughout the community. So indoor, prolonged contact, that's where we see the most risk for this virus. And moving forward, we're going to have to keep that in mind as we loosen restrictions.
From the Winnipeg Free Press, Danielle.
Hi, good afternoon, Dr. Roussin. I I hope you can make sure I'm understanding this correctly. So with the those probable cases of B117, is it being analyzed as any other variant of concern, or what happens next? Do we just move on from those cases now?
Yeah, so they're sequenced and then added to that database, both nationally and internationally, where they look for things and whether a certain variant is becoming one that's of concern. And so certainly we look at it here at the provincial level to see if we're seeing, any indication of increased hospitalizations, if we see increased secondary attack rate on it. From this, we're just seeing that this is just one of those variants that does not seem to have any clinical implications. But like I said, over time, this is not the last variant that we're going to see. We're going to see variants continually develop, and we're going to see new variants of concern develop over time as well.
Okay, great. Thank you. And I know you said you don't have the total number of samples for variants that have been screened in, but can you talk about the volume of screened-in samples awaiting confirmation, and are you seeing an increase in the number of markers among positive samples?
Yeah, so over the weekend, our public health lab went back to the beginning of February, screened all samples back to beginning of February that they had to look for this. So we did see a number of hits in addition to the 7. I don't have the specific number. But all of those have been sent for sequencing. Many of them are from the same community, so you can expect the sequencing is going to show the same as for those 7, but we'll follow up to ensure. Okay,
thank you. And I was just wondering what you're seeing when it comes to contacts per case. Since we've relaxed restrictions, how does this align with the province's expectations as we move forward with reopening?
Yeah, I think we haven't seen a large jump in contacts per cases overall. Certainly we see that range though. So we're seeing outbreaks in certain areas. We've seen high contact events that have led to it. We've seen, I've mentioned a couple cases where we've had 60 plus contacts. So that on average, we're still seeing roughly that 2 to 3 contacts per case. But that has a huge range of 0 to over 60.
From Global News, Brittany.
Good afternoon, Dr. Roussin. I'm just wondering what kind of effect the variant is going to have on our reopening plans if we do start seeing more and more cases of that popping up here in Manitoba.
Yeah, well, it certainly will have a negative effect on any of our approach. If we see a variant of concern that is significantly more infectious, then we're going to have a much higher secondary attack rate, which translates into a higher R value, which means that a lot of the things we rely on to keep the numbers down are shifted. So it's really important that we keep these variants of concern from grabbing a foothold in our community, or it will really have a negative impact on our ability to reopen.
And when we start looking at the different variants, I know you said some don't have a concern because they're not showing more transmission or higher severity levels, but how much do the number of new variants that we're seeing show that COVID might start to become endemic?
Yeah, and I think that's certainly the concern. I think it's clear that we're not going to be just done with this virus, certainly not this calendar year. And with these RNA viruses, as they change over time, as they adapt, we're going to see variants of concern that may increase transmission. We could see some that may increase the severity in some individuals. And then we need to consider the possibility that we'll see variants that escape the vaccine. And so these are all things that we have to be aware of, and our reliance on the fundamentals is not going to be going away anytime soon.
And when we look at variants too, will that change our vaccine strategy as we move forward if we start seeing cases popping up in clusters and we start seeing more variants here?
Well, I think right now our vaccine rollout is just all limited right now on supply. So once we overcome the supply issue, we're just going to be vaccinating as many susceptible Manitobans as possible. So the variants, certainly, bring out the importance of trying to get that vaccine and get that protection as many Manitobans as possible, as quick as possible. But all that right now relies on our vaccine supply.
From the Brandon Sun, Michelle.
Yes, good afternoon, Dr. Roussin. Could you describe the kinds of conversations that happen behind the scenes about ongoing reopening in light of this variant threat? What talk about it?
Yeah, so I mean, we certainly follow our numbers, so just the epidemiology that we're seeing. We try to look at some modeling numbers, but especially when you throw in the variable of the variance, it's difficult to look at all possible scenarios. And then, of course, we look at the demand on our healthcare system. And so we're trying to balance the importance of getting things open, the importance of some of these things that have been restricted or even closed, for Manitobans, with the clear need to avoid a large third wave and having to go backwards. And so these are the type of conversations that we have with, multiple stakeholders. And for our next round, they've already begun. So and so we spend a lot of time trying to find that right balance.
Okay. And is there anything that you can point at specifically that would trigger our going back to more arduous restrictions?
Well, there's a lot of things that we could point to, certainly not one thing. And so our overall case numbers, the test positivity, the demand on the healthcare system, these are all important things. If we see the community transmission of a variant of concern that is driving up numbers, of course, that would have to come into play. So again, it's not just one thing we look at. We look at a number of things, and over time. So we'll continue to look at all those indicators.
Okay. And I'm also wondering, looking back over the past year, community transmission, I know it's vague and it's hard to pinpoint, but were there locations that kind of stuck out as the most perilous, for lack of a better word?
Yeah, so it's a tough question because by definition, if it's community transmission, we don't know where it was acquired. That's why that's what we refer to as community transmission. And so we saw in the early second wave, we saw a lot of concerns that transmission was taking place in areas where people gather indoors, right? So at that time, it was restaurants, it was bars. We have a number of outbreaks in this jurisdiction and in other jurisdictions in Canada around the world related to faith-based gatherings, and so again, it's not the people running those facilities. It's just the nature of the virus. The virus spreads with indoor prolonged contact, and so that's where we're going to see transmission occur.
From CJOB, Will.
Good afternoon, Doctor. I'm wondering, would you and your team proceed with reopening plans, even if you had a good sense or a good reason to believe the province would need to lock down again, even if that was, 2, 3, or 4 months in the future?
Yeah, so we I don't think we could be in a position to know that, it's always a possibility, and it's what we want to avoid. So it's certainly possible if we see increased transmission, which is translating into increased hospital demands, that we'd have to reimpose restrictions. We don't really have an alternative. We can't have our healthcare system overrun. But I think we're going to, look at what we see what we're seeing in front of us. If the numbers continue to trend in this direction, we'll be able to continue our reopening plans, but we'll always have to watch things very closely because we can't let ourselves get back into where we were in November and December.
Okay, thanks for that. Modeling out of Ontario released just last week is showing that if public health measures there are lifted, the variant first identified in the UK would eventually become the dominant strain of the virus. And some other projections for new daily cases are really quite staggering. I'm wondering, does your modeling show anything similar to that effect?
Our modeling is showing, again, various various scenarios. And so if we have the same level of public health restrictions with good adherence, then we see our numbers continue to trend down. And then every step away from that, we see them rise. And then if we see the introduction and the community transmission of a variant of concern, such as a UK variant, then we'll see those our numbers back what we were seeing in November and December.
Okay, final question actually comes from a viewer wondering what % of people who are put on ventilators are one day able to breathe on their own again, and has that ratio remained relatively stable since the beginning of the pandemic, or have you noticed any changes?
Yeah, so I don't have that that information. That's more of the clinicians, with it. So we see in our ICU that a significant proportion of the COVID cases that make it to ICU will require to be ventilated. We see that the majority of them spend that, within that 7 to 10 to 14 days on a ventilator. But then we see a certain proportion, up to a quarter, that are actually ventilated for many, many weeks. And that's contributing to the, demand on the ICU. And so we could direct that question more to the clinical side of things.
From the Winnipeg Sun, Scott.
Hi, good afternoon, Dr. Roussin. I just wanted to clarify. So up north there with those the variant samples that were flagged, I guess this is so. What would lead to these samples being flagged, and if they keep getting flagged, like, do you have to change the way that a sample? I guess the requirements to being flagged. That's not the right word, but like, if some of these variants are being flagged even falsely, how will you better, I guess, negotiate that going forward, so you're not just sending multiple, or tons of different tests in?
Yeah, and so this is the nature of screening tests. It's, so for any test, that's always balancing between sensitivity, missing something that you're looking for, and specificity. When you have a positive test, how likely it is to actually be what you're looking for. So for screening tests, we want them to be highly sensitive. We want it very unlikely that we actually miss something we're looking for. And so the trade-off there is that you'll often flag things that aren't actually what you're looking for, and we see that here. So in this case, a screening test looked for a specific deletion that's in the UK variant. It doesn't define the UK variant, but it's in there. And what we found was that this deletion happens to also be in this Manitoba variant that we saw. And so we'll have to continue to work to ensure we have the right targets on our screening tests, to ensure that we're getting a bit more out of the screening test. But this is something that's going to happen from time to time. This virus is changing, and so what's when we find certain markers in some of the variants, we're going to find that in others. Things are going to change over time, so it's why we need that national and international approach to surveilling the changes over time.
Thanks for that. When you're looking at those cases, in Pungasi, I guess, first instance, Are you looking at those cases now in a different light, even though they aren't the variant of concern, but they are a variant that kind of it flags differently? Have you noticed anything different in the way that virus kind of, or sorry, that I guess little variation in that virus in the COVID virus there kind of transmits to people? Have you noticed anything different in that?
No, we haven't had any indication that this is a variant of concern. We've seen this variant in the past here in Manitoba as well. So, as of right now, it does not appear that this is a variant of concern.
Okay, thanks. And the other samples that came from, I believe it was Cross Lake, are you kind of leaning towards the same thing with those cases then, or is it completely different? Like, I know you're obviously erring on the side of caution, but are you erring in the same direction as maybe they're just the same sort of strain, but not the UK variant?
That's right. So, public health is going to act on anything that screens in as if it's the variant until proven otherwise. But we're expecting to not see this as a UK variant in those communities.
Our final reporter this afternoon from CBC Radio Canada, Matthew.
Hi, Dr. Roussin. Can you give us an update regarding the outbreak at St. Boniface Hospital?
I don't think I do have anything updated numbers on that, so we can just provide that for you after.
Okay, thanks. I don't have a follow-up question.
Thanks, everyone. This concludes our media briefing.